Hi, my name is Taylor McGill, and today I'm going to be performing the task of oral gavage in a mouse. I've currently got him restrained in my hand, so I've tilted his head and neck back, and I've restrained his body. So I'm going to insert my catheter caudal to the incisors, down the esophagus, and I'm going to give my medication. And that is how you perform the task of oral gavage in a mouse. Hi, my name is Taylor McGill, and today I'm going to be performing the task of administration of subcutaneous injection in a mouse. So I currently have a scruff on the mouse just caudal to the ears, and I've got him with all 4 feet on the table, so he has good footing. And I've got my injection. So I'm going to inject cranial to caudal in this tent that I've made, and using the syringe to help keep his head down during injection. Alrighty, so cranial to caudal, using the syringe to keep his head down, making sure I'm in that subcutaneous space, giving that injection. I come right out. And that is how you perform the task of administering subcutaneous injection in a mouse. Hi, my name is Taylor McGill, and today I'm going to be performing the task of an intraperitoneal injection in a mouse. So I currently have my patient restrained. I have a scruff, and I'm holding his lower limbs and the rest of my non-dominant hand, and I'm going to tilt him with his head pointing towards the ground, lower than his abdomen. So to find the correct injection site, I'm going to locate his stifle as just a visual marker for where I'm going to inject into the lower right or left quadrant of the abdomen. So I'm going to choose his right side, and I'm going to inject at a 30-degree angle into the muscle. And I'm going to aspirate to make sure I'm in the correct area. I'm going to give my medication, and I'm going to come right out. And that is how you administer an intraperitoneal injection in a mouse. Hi, my name is Taylor McGill, and today I'm going to be performing the task of intravenous blood collection on a mouse. So I have my restrainer holding the mouse for me so I can apply a rubber band tourniquet on his tail. Alrighty, so now I'm going to visualize the lateral vein on the tail. And once I've visualized it, I'm going to go ahead and place my fingers to warm the tail and dilate the vein. Alrighty, so I'm going to brace the tail against my hand. Alrighty, so bracing the tail against my hand, I'm going to inject bevel up into the tail vein and draw back. And that is how you perform an intravenous blood draw on a mouse. Hi, my name is Taylor McGill, and today I'm going to be performing the task of restraint of a mouse, and I'm also going to determine the sex. So the first thing I'm going to do is, if I were lifting out of a carrier, grab the proximal portion at the base of the tail and lift out of the carrier and place onto a surface so that he can get his footing. And then I'm going to take my index and thumb, and I'm going to glide along the spine and feel for a scruff and lift with my index and my thumb and place my little finger around his tail. So now that he's in my palm, I'm going to determine the sex of this mouse, and because his genitalia and his tail are further away from each other than a female would be, I have determined that this is a male mouse. So that is how you perform the task of restraint and determining the sex of a mouse. Hi, my name is Taylor McGill, and today I'm going to be talking about mouse husbandry. Mice like to be kept together. Females and females can be housed together, although male and male cohabitation should be avoided. You can keep males and females together only if you want to plan on breeding them. It's not advised if you do not want a litter. They do like to have lots of enrichment. They are nocturnal, so they'll stay up more during the night, but a couple of sources of enrichment could be wood blocks or tunnels, or paper towel tubes. They also like to climb, so a ladder could be included in that enrichment. In their housing, we should make sure that a lid is kept on the top of the cage. An aquarium can actually be used as long as it has a mesh lid, anything with a solid bottom on it, and then several inches of aspen shavings so that they can burrow. You need to feed them a rodent-specific pellet. Their diet can also be supplemented with grains, fruits, and veggies, but they do need that rodent-specific pellet in addition to their food being rotated every 24 hours. And as far as water, you can get a water dispenser somewhat like this one. This one's a little too large for the mouse we were working with, but something like this that can be replenished and used as needed. So that is some basic mouse husbandry.